All right, so now we're going to move on for maybe the last 15 minutes, and we're going to talk about kids and lambs. All right, and so how do we do this? How do we get kids and lambs off to a good start? So those of you who have sheep and goats know that if you get these creatures, if you get these newborns through the first couple of days, usually they're good to go. The majority of losses occur in the first 3 days and most within the first 24 hours. And so what can we think about to do pre-kitting or lambing that will be preventive? One, so vaccination. So typically the only vaccine that you need to know that is the most important vaccine for sheep and goats is CD and T. So Clostridium perfringens type C and D and Clostridium tetani. That is, and we'll talk about this at the end of this presentation, the most important vaccine that we give to our sheep and goats. And what we do here is we vaccinate the dam. So we're vaccinating about 4 weeks prior to kitting and lambing. And then what that's going to do is that's going to provide antibodies for the lambs and for the kids in the colostrum. So that's really our best bet to provide that immunity to those kids and lambs that'll last, for the first 2 months of life. If we're talking about lactating animals, we want to give that udder time to rest. And so we would want to have a dry period or a period where those animals are not producing milk for at least 60 days prior to kitting or lambing. And that's not usually a problem, even on dairies. Typically, we don't have a problem achieving that. This is when, pre-kitting or pre-lambing, hopefully you did this at weaning because you don't want to keep an animal around and feed them if they have a bad udder. But examining the udder and the teats for problems, watching the dams closely and attending kitting and lambing, having cameras, having a bunch of students, that's probably not feasible for most of you, going out and really watching for kitting and lambing to happen. So we want to be able to intervene if we need to. And so colostrum. So colostrum is the most important thing that we can do for our kids and lambs to get them off to a good start. And the thing that we talk about is immunoglobulins, but that's not really all that's in colostrum. So we also have immune factors. There's a bunch of good stuff that goes and gives local protection in the gut. It's very nutrient rich, so it's got a very high fat content, high protein content, and so it really kind of jumpstarts the kid or the lamb. And so as far as how much should these kids and lambs consume, so if they're the one thing that's important, if we have, so this is a goat, these are her 2 kids. And so one thing that we want to make sure of is if we're going to let those kids or lambs nurse, which most of you probably do, you want to make sure that they nurse. So, they should be up and nursing within 30 minutes to an hour of being born. And so that's something that we want to watch for. And we want to really watch to make sure they're latching, because that isn't always the case, especially if you have, maybe you had a problem and that kid or lamb came out just a little dumb. They might not be able to get to that teat and nurse appropriately. And so if we're gonna, maybe for disease reasons, or maybe we have a dairy, we're gonna remove those kids from mom. These are the sort of the guidelines for how much colostrum a kid or a lamb needs to eat. And so I think the easiest is probably 1 ounce per pound of body weight, 3 times in the first 24 hours. So for example, a 5-pound kid should get 5 ounces 3 times in the first 24 hours. Or sort of the same volume would be 15% body weight. So this also means you should probably have a scale, and that's for a couple reasons. Getting weights is important for this, but then it's also a good way to monitor growth of your kids and lambs and monitor performance that way. A really nice trick is that the ice cube trays are all 1 ounce. And so if you have extra, and we'll talk about saving extra, I think in the next slide, and having a colostrum bank, you can put it in this ice cube tray, you can freeze it, and then you can pop them out. And so it makes it really nice for heating back up. You can really dose pretty accurately for your kids and lambs. And then another really important thing is we want to ensure the colostrum is raised to body temperature before we feed it, because as we'll talk about, being cold is a risk factor for death in newborn lambs and kids. All right, so having a colostrum bank. So if you have does or ewes that produce more than her kid or lambs can eat, we can save some. So you can milk that animal out and store in a sealed container in the freezer. And depending on the volume, some people like using like Mountain Dew, soda bottles. Those are fine. Because then when you warm them up, you basically just pop the nipple on and go. As far as we want it to freeze pretty fast. So what I like to use or what I would prefer is a Ziploc bag because that you can flatten out and it freezes really fast because the time it takes to freeze, you have more chance of bacteria growing, and which is what we don't want to happen. So as far as what we should put on the bag, so we should probably put the ewe and the doe ID, so we know who it's from, the date, and then typically we say that colostrum maintains most of the good things about it for about a year. So freezing destroys immune cells, so they essentially the contents of the cell crystallizes and they burst. But it doesn't get rid of nutrients and it does not get rid of immunoglobulin. So like 2 out of the 3 really good things are still in it. And that's something we want to warm slowly in a hot water bath. So if we warm it too fast, all the immunoglobulin will curdle and then it does no good for anyone. So that's, again, a good tip to warm it slowly. All right, so now we're going to move on to talk about one of the biggest problems, at least in the first 24 to 48 hours in our lambs and our kids, and that's this weak and cold phenomenon. And so the best thing that you can do, again, is invest in a thermometer. And so you can't know if your kid or your lamb is cold unless you take its temperature. So having a thermometer handy is a nice thing to have. And so here are the normals. So a normal rectal temperature in a kid or a lamb is 102 to 104 Fahrenheit. So they run a little hotter than we do. They're mild, we consider mild hypothermia or mild cold stress at 98.6 to 102. And then we consider it to be severe when they're under 98.6. And so what do we do? Cold stress beginning at 50 degrees Fahrenheit. What do we do? And so this is a really cool algorithm from this website. So if you go to amafra.gov and then look up like sheep facts, they have a lot of great information on that website. But I really like this algorithm because it's pretty clear on what you need to do. And so like, let's say we have a lamb and this lamb is sluggish, it's not nursing, it feels cold. You put your finger in its mouth and it's cold, its limbs are cold. What do? We take its temperature, easy. Then what do we do? So based on what the temperature is, that's going to determine what we do with this animal. So if we're just mildly cold, mildly hypothermic, and the animal can swallow, we're going to feed it with colostrum if it's newborn, or milk, warm milk. And then we might have an aftercare unit, but we might not. And then we're going to return that animal to the ewe, to its mom. And then, take its temperature again during the day to make sure that it's doing okay. If we're cold, if we're less than 98.6 on a thermometer and we're less than 5 hours old, so this is an animal that still has all of its brown fat, still has all of its energy reserves. And so we don't need to worry about, all we need to worry about is getting that animal warm. Then we can put that animal in a warming box, then feed once it's warm, and then return to you. And so there's a lot of different ways we can warm an animal. And we'll talk about that, I think, on the next slide. But what we typically do, we'll put the animal in the warming box, and then we'll take the temperature every 20 or 30 minutes until it comes back to above 102. If the animal is a little older, that means that animal has probably depleted all of its energy supply. So all of its brown fat that we have as babies, it's all gone. And so that's an animal that we need to think about providing some energy before we warm it. If the animal can swallow, then we could tube, and I think we'll talk about tubing here. We can tube some colostrum or colostrum, I guess we're still in the very early stages here. If the animal cannot swallow, then that's when we would consider giving glucose. And the reason we have to do this is because if we warm the animal without providing some energy, the animal will start heating up, the metabolism will start increasing, and there will be no energy to support that metabolism, and they will die. And so that's why we have to provide some energy before we warm. And then we feed colostrum again, potentially, and then we return to the U or go to the aftercare unit. And so again, the principles of treatment here are, you know, depending on where we're at, are in general warming and energy. This is an intraperitoneal injection. It's something that you can all learn how to do. Your veterinarian can teach you, and it's a nice way to provide glucose directly in intra-lamb or intra-kid. And yeah, so when we're using the warming box, you want to check the lambs at least every 30 minutes because we don't want to overheat them. So how can we warm kids? So I think Kyle talks a little bit about, you know, having towels, a hair dryer. Don't put your kids in the dryer, but you can put the towels in the dryer, warm them up, and then use those. One thing you have to keep in mind is that we don't want to, so one way to rapidly warm an animal is to put them in a hot water bath. But one thing that we don't want to do is we don't want to wash off the amniotic fluid or the smell of mom. And so one thing that you can do is you can put them in a little plastic bag, that's like a little garbage bag up to their neck, and put them in the water bath, heat them that or warm them that way. And then when you take the bag off, they're going to smell like mom again. And then the other thing that we can do is we can provide heat lamps. And so this is just two options. I like the option where the kid can kind of temper their own desire for warmth. And so they can move away or move closer as needed. I would say that if you're going to use something like this, which, a 50-gallon drum sort of situation, you have to have a little bit of caution with the number of kids that you have, because if it's cold outside, kids will go in there and they will pile in there, and they will suffocate each other. So you have to make sure that you have enough space, or you have enough space for the kids that you're trying to keep warm. All right, and then just briefly, we'll talk about tube feeding. So this is just to remind you the differences in anatomy between an animal that is swallowing and an animal that is breathing. So an animal that is breathing, typically we're breathing in our sheep through our nose. And so when we do that, the soft palate comes down, the epiglottis comes up, and we get air down into the trachea. When we're swallowing, the epiglottis obviously covers the trachea or the windpipe, and then we have access to the esophagus. So the esophagus is behind the trachea. And so this is important to consider when we're tubing. We want to obviously be in the esophagus. We do not want to be in the windpipe. And, really, if the kid is able to scream, hopefully they're not, because they're probably sick, so they're probably not going to vocalize a lot while you're doing this. But if we're using the correct technique, and we're aiming towards the back of the mouth, then we're going to be in the esophagus. And so one important thing, so you can all learn how to do this. You can all learn how to tube an animal, either from a neighbor who is good at it, from your veterinarian. It's something that I think everyone who has lambs and kids on their farm should be able to do, because it's really a life-saving thing. And so what we want to do is we have a nice red rubber catheter here, 14 or 16 inches is how long we want it to be. And we want it to go, when we measure it, we want to measure it because we don't want to put it in too far. We want to measure it to the back of the rib cage of the animal, kind of just like this. And then if we want, we can put a little mark on the tube as far as it should go in. That way we don't put it in too far. And then as far as technique, I like this technique where we kind of, we're sitting and we kind of put the lamb or the kid between our legs and kind of pinch the shoulders. Then we have really good access. And we're going to kind of use the curve of the tube to get it in the right spot, and then put it in as far to our mark, so we're in the right spot. And then this is where our 60 cc syringe comes in, where we can attach it to the red tube. And then we're going to use gravity. So gravity is our friend here. So if we're tubing colostrum or we're tubing some milk, we don't want to actually depress the syringe. We want to let gravity do its job. And so this is the example of that. And then this is also important. So when we're done, so maybe we gave 60 cc's, so that's 2 ounces of milk or colostrum here. You can see that they're kind of have their finger on the top of the tube, and that's so we don't get any milk going into the lungs as we're pulling that tube out. All right, last but not least, vaccination programs. So maybe this is what some of you are here for. So here we go, last 5 minutes. So CD&T is the most important vaccine for small ruminants. Everything else, whether it's reproductive vaccines, it's ORF, it's CL, maybe you're thinking about integrating, maybe you go to the local petting zoo, or you have a petting zoo and your animals need to be vaccinated for rabies. All those other vaccines, as far as I'm concerned, are risk-based, and should be at the advice and discussion with your veterinarian. So just to remind you, so the CD&T, what the C and D stand for is Clostridium perfringens, type C and D. And so this is what causes overeating disease, pulpy kidney disease, maybe you've heard, enterotoxemia, sudden death in lambs or kids. Can be a fairly devastating disease. A lot of times it's due to changes in feed. And then the T stands for tetanus. So this is an animal a calf, obviously, but a calf that was banded. And this is very classic presentation for tetanus. This animal did not have, was not vaccinated, did not have anatoxin, and was euthanized because it succumbed to tetanus. So remember I said that we're going to vaccinate mom on a yearly basis. So we want to vaccinate everyone in the herd on a yearly basis. Goats are a little different. So goats actually, if you have problems or you're concerned, you can vaccinate your goats more frequently. They actually chew up, or the antibodies go away faster in goats than they do in sheep. But regardless, we want to vaccinate moms, all moms on the farm, 4 weeks prior to the start of lambing. And so if we don't do that, if we have colostrum or feeding colostrum from unvaccinated does, we want to start vaccinating with CD&T at 4 weeks, and then vaccinate every 4 weeks until 4 months of age. And if you think about it, these animals are going through a lot of nutrition changes, and one of the big triggers for dying from enterotoxemia are feed changes. And so, up until 4 months, we've got, transition from milk to solid feed. We've got some forage thrown in there. And so we've got some change there. So that's the rationale there. And then if we have colostrum from vaccinated does, so again, remember 4 weeks prior to the start of kidding or lambing, we can start vaccinating in 8 weeks. And then again, every 4 weeks until 4 months. Very important that CD&T, so the reason we say, 8 weeks and then 12 weeks, or 4 weeks and then 8 weeks, is that CD&T, this vaccine needs a booster. So you need to do those 2 doses 4 weeks apart, or the vaccine is going to be useless. So if you vaccinate an animal and then never vaccinate them again, they are not protected. And then just a note about where to vaccinate. So this vaccine goes, it's 2 mL per dose. It goes under the skin. Some important, and these are kind of the locations that we can use. So, in the neck, probably even a little higher in the neck, under the skin, over the rib cage. If you have show animals and you're concerned about detecting caseous lymphadenitis, if it should show up, you can go in the axilla region here. And that can work really nicely under the skin in all those places. One thing to keep in mind, if you have a small flock, or that's probably the biggest risk, you want to keep an eye on the expiration dates of these vaccines, because if they stay in the fridge, they're refrigerated, they stay in there for a long time, and you want to make sure that you are vaccinating with vaccine that is in date. And you also want to make sure that you're handling it correctly. So I know of flocks that have had like outbreaks of sick animals because they vaccinate, maybe the needle that they're using is dirty. And so we want to make sure that we're keeping that vaccine refrigerated and then, handling it correctly as well. All right, so last but not least, here are take homes. So when we think, again, remember prevention, we want to prevent these diseases from happening in the first place. I want you to be able to detect them when they happen and treat them, but we want to prevent them. So how do we prevent doe and ewe disease around the time of parturition? So this is proper attention to nutrition in the last 2 months, and in addition to that, body condition scoring, making sure those animals are in the appropriate condition, not under or over condition, and fetal counting that can help. And then attention to udders. So whenever that happens, either at the time of lambing, making sure that you're watching ewes and does for signs of lameness and for illness, especially in the first couple weeks of lactation, and then for sure at wean, so that we can detect animals that we might want to remove from the herd or not breed in the following year. So and really the prevention of lamb and kid disease at birth depends on colostrum, number one. Colostrum is the most important. And probably I would put warm next, so warm environments that are also clean and dry. And then vaccination with CD&T. So this vaccine is considered our core vaccine in small ruminants. And vaccination of the kid and lamb really depends on what you're doing with mom. So again, 4 weeks prior to the start of kidding or lambing. And then colostrum from those vaccinated dams protects kids and lambs for the first 8 weeks of life. And so thanks for your attention. I will be happy to answer any questions if they haven't been answered in the chat. Feel free, if I didn't address something or you have a further question, to contact me.
Thank you, Dr. Whitney. I'm going to stay on that topic right there at the end. Because on the vaccination, and this just one came up, and we've got, again, you provided an inspired tremendous amount of discussion on the chat, as you would expect. So yes, that's why we will have some follow-up discussion, and in fact, a follow-up webinar as well. But I vaccinate 4 weeks before earliest lambing date, but the ewes will be lambing over 4 to 8 weeks after the initial lambing date, which commonly makes sense. So the later lambing ewes were vaccinated significantly more than the 4 weeks. Does that still fit the expectations?
Yeah, so that's a great question, and the answer is that yes, it does. So those ewes, and I think you're talking about sheep. Those ewes will still be covered and still will transmit the immunoglobulins in their colostrum. And there is some, there's a lot of discussion, especially at this time of year, about pregnancy toxemia and clostridial diseases on some of the vet listservs. And there is some discussion that it might actually, 4 weeks is what we typically consider, but some discussion that it might actually take a little longer to develop those antibodies and get them in colostrum. So you're not shooting yourself in the foot at all if you vaccinate, everyone at once, and then you lamb or kid over 2 months.
Okay, Whitney, one of the most common questions that came up is that my ewe, and Kyle, if you want on this one as well, but my ewe is already too fat or a little bit more obese than I need to be, and we're within the last month. I know that we have to battle that one relative to keeping enough nutrition for those lambs and as they're developing. What's your thoughts on that, Whitney? How can we address this? Let's say that we're a month out and we're already at body condition score 4+.
Yeah, so that's a really tough one. I mean, we're going to try to maintain, not gain weight, and get, as much energy into those animals as we can, and watch them really closely. So, like a hawk. And at the slightest chance or the slightest sign of anything going wrong, then that would be the time to start addressing it. I know that that's a common challenge, and I guess I would also suggest get through this year and then work really hard in the next 12 months to really get your lamb, or your does into more of that 3. A body condition score is about 12% of an animal's body weight. So, that can be, depending on the weight of the animal, that can be a significant amount of weight to lose. And another thing I would suggest, and we have some of the farms that we work with have had a lot of success with buying a scale. And that's not going to work for everyone, but weighing animals, it's going to help with your parasite control programs too, to accurately dose animals that need to be dosed. But that can give you some real information kind of as you are working towards, losing some weight in some of those animals. And I know like there are some breeds that are really easy keepers. And so it's a challenge that we run into time and time again.
Thank you, Kyle. I'm going to call that one a check mark because she nailed it. So we'll save your talents. All right, Kyle.
I would just say if the ewes can get exercise too.
Actually, that's a very good point.
If you can get those ewes out exercising, that'll help their condition, stamina.
Absolutely. And in fact, some of the exercise can help us relative to the colostrum quality and the immunoglobulins as well. So certainly a multi helpful focus. So with the colostrum, is there a preference on the replacement colostrum or the natural colostrum?
That's a great question. So there is only, as far to my knowledge, there's only one licensed product in the US that's available, and that's the Land O'Lakes Kid and Lamb Colostrum Replacer. It's bovine IgG, and it's specifically formulated for kids and lambs. And it's licensed, which means that it's tested, and the amount of fat and protein and immunoglobulins that are in it is consistent. And so if I were going to use a colostrum product, colostrum replacer product, that's what I would use. And I would probably use a colostrum replacer over a bovine colostrum, just because bovine colostrum is a lot lower in the energy for that kid or lamb. But I would prioritize, I didn't talk about heat treatment. So if you're worried about disease transmission, like CAE, for example, that's something that we could talk about as heat treating the colostrum, but I would always prioritize maternal colostrum over, so colostrum from the dam or the ewe of the lambs or kids that were born over any other product.
Okay, thank you. And just a little bit of a clarification on the animal's temperature, or the baby lamb or baby kid's temperature and the colostrum. So there was a little bit of confusion, and just what's your thoughts and getting them warmed up and where we need to be?
What's the confusion?
Well, the correct answer is just a confirmation that we need to get those lambs warmer or the kids warmer. Otherwise, that colostrum going into them if their tongue is cold, that doesn't serve us any purpose.
Yeah, so thank you for allowing me to clarify. So yes, so what I would do, if this is something you run into, like develop a flow chart, like if this, then that. So the challenge becomes how old the animal is. So if the animal is if it's a newborn that's cold, it's appropriate to warm that animal up and then tube the colostrum. So warming is more important in that situation. But when we have an older animal, they don't have the brown fat reserves. So if you try to warm them, or if you warm them without giving them any energy to use as they're warming up, they will die. So that's why we think about if they can swallow, we can tube them. And if they can't swallow, that's where we would rely on something like, I know that some people like to put like Caro syrup on gums, which can work. That's fine. Ideally, we would be giving those animals dextrose, so intraperitoneal, where we're actually injecting it into the abdomen, which that's something that you can definitely learn how to do. The answer, I guess, is that it depends, and it depends on how old the animal is and what kind of how far gone, I guess, the animal is. Thank you, team. Is there any suggestions on when
if we have our ewe that comes in, that we don't get the milk letdown that we were aiming for, what's the quick suggestions?
So are you like in reference to milk production overall, or if they like the ewer just doesn't have a lot of milk or not letting down?
Just not letting down at this point. It's a question.
Yeah. Okay. So I mean, maybe Kyle can talk about what they do when they have an animal that is slow.
Well, I don't know if it's the best thing to do, but we'll try to kind of massage the udder with warm towels to kind of get maybe the lactation to start. We don't use any drugs. I don't know, Whitney, if oxytocin can be used. We don't. We do at the swine barn with our swine operation, but we don't do it in the sheep barn. And I guess we just kind of, try to massage the udder and warm towel the udder and try to get her feel the sensation of milk let down and try to, that's all we do with our students. And generally it's not been a problem for us, but I mean, maybe it is for others. So maybe you have a secret and maybe someone on the panel or out there watching has a secret. That's what we do.
Yeah, okay, that's great. I think that the current thought on oxytocin use is that by the time you give it, a lot of because that's what we're relying on. We're relying on the animal to be producing oxytocin. So if you're massaging the udder or stimulating the udder in some way, that should release oxytocin. Actually, like giving oxytocin, so that's the thing that allows milk let down. May work, but also probably it's just more important to stimulate that animal.
One thing about oxytocin, we're a little cautious because we want to make sure they're done lambing too, because we don't want to stimulate them to push harder if they're having hard birth. So it's kind of we just want to minimize risk, potentially if a ewe's still lambing too.
Okay, we're going to shift it just a little bit back to our nutrition, and I think maybe we can be able to evaluate if there's anything that we can do to reduce calcium deficiencies in the pregnant ewe. They have access to minerals, to free choice mineral and a protein pellet. And so what can we do there from a calcium standpoint? And again, we probably don't need to underestimate just for those pregnant females, the importance of having both free choice mineral and iodized salts as well.
Yeah, so I guess I'll start. So one thing that you can, so your forages can also have quite a bit of calcium. So alfalfa has, which is a really nice forage to be feeding to your late gestating animals. That has a pretty high calcium content. So that's another way that you can kind of add calcium in. Another way, so from a nutrition, I'm not a nutritionist. I like nutrition sort of, but you can do some forage analysis. So you can actually calculate, you can, take a sample of your hay, and you can take a sample, or you might already have, what you're feeding in your grain. You can take, estimate how much mineral they're eating, and actually calculate it out. It's hard to know, but also I would say that calcium treatment is very cheap. So if you have a slow animal, I don't own sheep myself, but if I did and I had a slow animal, I would not hesitate to give them calcium because it's not going to hurt them.
Yeah, I concur. We don't do nothing unusual here with our unit. We have the capabilities to get forage testing done, and then the sheep feed we use when we start supplementing the ewes prior to lambing is just a very typical balanced ration. And so with that in mind, we know their daily intake of calcium and does it match their nutrient requirements, the NRC requirements, and so we're very basic, nothing out of the unusual here. We just match their diet to their requirements. And we do
Absolutely.
feed mineral. I mean, we feed a loose mineral as well.
Sure, and having the mineral and the iodized salt as well. And it was discussed in our chat of both using corn for our energy and our soybean meal for our proteins. And so, I mean, those are simple ways, and they seem like options that at least provide us the help to get there. And like Dr. Whitney said, there's less room in the rumen, and so consequently, we just need to be more energy dense when we get closer to parturition, and so that kind of helps us to get there. Are there any questions or comments, Dr. Knauer, on pharmaceuticals that can't be used on a pregnant female?
Oh, okay, good question. So the two that come to mind are, number one is dewormer, which is valbazen or albendazole. So that typically people are using that for, it's labeled for liver flukes. It's similar to fenbendazole, and that's should not be used in pregnant animals in the first 30 days of gestation. The other drug that you don't want to use is dexamethasone. So that is a steroid that is going to induce abortion. So unless you're trying to do that, that is something that you want to stay away from. As far as, other drugs or treatments, affecting the babies, affecting fetal development, there's not really anything else that comes to mind.
And a question here at the end, how about BOC, or where do we need to be on selenium?
Yeah, that's a good question, and something that I thought about integrating but didn't. So that comes down to where you are in the country, and what your forage levels are. If you're in a selenium deficient area, it's not going to hurt to hit your lambs with BOC when they're born. Pretty hard to create, with one shot of BOC at like 1 ml per 40 pounds, I think is the dose. Pretty hard to induce any sort of adverse events with that. So yeah, I think if you are in a known deficient area, and especially if you have forages from that known deficient area, it's a good thing to integrate into your newborn lamb or kid protocol, because white muscle disease is kind of a stupid thing for kids and lambs to die of, to be honest.
What's the opinion on providing a copper bolus in comparison to the pre-choice minerals?
Are you talking to me?
Do you have any?
That's a little out of my pay grade. I don't know that that information in goats. I don't know.
So I would stay away from copper boluses, definitely in sheep. And
sheep, but don't know the goats.
Yeah, and I mean in goats, like typically people are using copper wire particle boluses to as an adjunct therapy for a parasite control program. But even then, I mean, we can run into toxicity problems. That's something that you should not tread into lightly. That is something that needs real discussion and thought before you do it.
Great. I'm going to open it up to my co-collaborators and panelists if they just have one or two questions here, and we need to get this closed up. But I'll open it up to my colleagues if they have something that we should just finish up with.
We did have a request from Dr. Whitney to put that link in the chat that you talked about with milk fever. So if you have a chance to do that, that would be great, Dr. Knauer.
I can do that.
Thank you. Other than that, I think we have lots of questions still hanging out there, but I would invite that as an opportunity for you all to come to our February 18th webinar. And I did see a question about parasites, and if you hang on in the chat, I will put a link that actually from a talk Dr. Whitney gave last spring that touched on parasites a lot more. So just hang tight and I'll get that in there.
Great, and thank you to our presenters, Mr. Kyle Roseboom and Dr. Whitney Knauer, on providing a tremendous amount of depth of knowledge and going across a large spectrum of our ewe and doe and lamb and kid health. And so thanks so much to those two on providing their information. And again, we set records, at least in our team, for the University of Minnesota Extension and being driven to discover, because we had a tremendous amount of people on. And we look forward to working with you and having a February 18 webinar where we will continue to answer some of the questions because we've had great discussion. So thanks so much and have a joyous evening.